Okay guys, today we're starting Global Balance, which is a real pleasure because we can manage not local pain but also any complicated disorders like Zang-Fu disorders, cardiovascular, digestive, IBS, hormonal, pain all over the body, fibromyalgia all over the body. So any disorders that go beyond the local pain or local disbalance. And this acupuncture works so beautiful and it has so fast response, and to me it makes more sense because it has to satisfy two criteria: global balance This is how Dr. Tan called it, but I call it the acupuncture balance method for Zang-Fu disorders, because we have to embrace the system. We're not talking only about the blood circulation within the certain place, but we have to tackle the channels. We have to move blood in a smart way. We have to heal the organs, and we have to find the right way to do it. Dr. Tan advised to avoid Zang-Fu diagnosis, but I think that it's not quite right. We have to know the exact picture what's going on in the body from the Chinese medicine point of view. Dr. Chao Chen, who was the origin of balance method, he took into consideration yin and yang, of course. So we will take into consideration yin and yang and the principles as well. And also incorporate into balance method the pulse diagnostic methods of Dr. Jimmy Chang, which helps us enormously to choose the right channel to needle. Without this knowledge, the balance method wouldn't be so precise, but knowing the pulses, you can needle precisely, because you will know what's going wrong in the body, which channel needs to be supported. So you will be able to make the right choice. And you will see better which pattern of global balance to use. Okay, so there are two criteria that must be satisfied in global balance. The number one is static balance. And number two is dynamic balance. What is the static balance? Static balance is when we choose one of the four stable structures. Our treatment must be stable from one point of view, but on another point of view, it must be diverse, it must be movable, it must reflect the nature of yin and yang. That's why number one is static. We choose four main structures. Structure number A, it's like the sand clock. Structure number B is sand clock on a side. Structure number C is just a square. And structure number D, we won't meet it very often, just once or twice. So I will explain you what these structures are. This is one arm, this is another arm, this is leg, and this is another leg, and this is a head. Can you see that? And this is breast, and this is the skirt. so we can adjust the channels to the structure. The lines, horizontal lines, diagonal lines, and vertical lines, they mean connections between channels according one of the system, 1, 2, 3, 4, 5. We don't consider number 6 now in global balance, for now, constructing these patterns. So there are relationships between heart and small intestine according to system 3, pericardium and Sanjiao according to system 3 as well, for both structures A and C. According to system 3, lung and large intestine are related. And the same about bladder and kidney, stomach and spleen, gallbladder and liver. We can see relationships between pericardium and liver on the diagonal according to system 1, and pericardium and system according to system 5, as well as heart and spleen. Heart and gallbladder are related according to system 2 as well as system 4, and the same for the structure C. Pericardium and stomach are related according to system 2 and 4, as well as lung and bladder, and according to system 4 there are relationships between lung and kidney in a vertical position. So these are the static structures, static balance.